Hello, masterminds. Welcome back to class. The topic for today is interventions in mental health care. In the course of this lecture, we are going to explore key treatment and management techniques that are used to treat individuals with mental health problems and how to improve their lives. Ladies and gentlemen, if you are ready, grab your pens and your notepads because class has started. First of all, let's try to understand what we mean by interventions in mental health care. In mental health care, interventions are actions that are aimed at reducing symptoms, improving function, and promoting recovery of individuals with mental health disorder. Therefore, any action, being it treatment or therapy, whose effect is aimed at reducing the symptoms of a mental disorder or improving the function of an individual affected with a mental disorder or promoting their recovery and reintegration back into the society can be referred to as an intervention in mental health care. There are a lot of interventions in mental health care, but most of them can be grouped under what we call the biopsychosocial model. Under the biopsychosocial model, you can tell that we have the biological aspect of the model, we have the psychological aspect of it, and then there is the social aspect of it. That means that the interventions or the actions that are used in the treatment of mental health disorders can be biological, psychological, or social. We are going to take each of them one at a time and explain further. We are starting with the biological intervention. The biological interventions are those interventions that are aimed at changing how the brain works and effect causes a reduction in the symptoms of a mental disorder or improvement in the lives of an individual affected with a mental disorder. A typical example of a biological intervention is the use of psychiatric medications or psychotropics. Now, there are a lot of psychiatric medications, so we are not going to cover all of them into details, but I'm going to give examples of some psychiatric medications. We have medications like antipsychotics, we have antidepressants, we have mood stabilizers, and we have anxiolytics. We are going to cover all of these into details in another lecture video. But for now, I want you to understand that antipsychotics are psychiatric medications that are used in the management of psychotic disorders, such as schizophrenia or brief psychotic disorder. Antidepressants, on the other hand, are used in the management of depression or some forms of anxiety disorder, such as obsessive compulsive disorder. Mood stabilizers are used in the management of bipolar disorder, being it bipolar 1 or bipolar 2, and a typical example is lithium. And finally, anxiolytics. These are medications that are used in the management of anxiety disorders, and they are also used for the short-term management of agitation. Like I said, I'm going to explain all of these into details in a separate lecture video, but for now, understand that these are some classes of psychiatric medications under the biological interventions in mental health. Still under biological interventions, we have a group of therapies that are collectively called brain stimulation techniques. Now, this technique uses energy like electricity and magnetism to change how the brain works as a way of reducing the signs and symptoms of a psychiatric disorder. A popular example of this technique is the use of electroconvulsive therapy or ECT, where electricity is applied to the brain of an individual with a mental disorder. Another example is transcranial magnetic stimulation or TMS. Now, TMS or transcranial magnetic stimulation is a non-invasive procedure where magnetic fields are used to stimulate brain cells to treat conditions such as depression and OCD or obsessive compulsive disorder. Finally, under the brain stimulation techniques, we have deep brain stimulation or DBS. Deep brain stimulation involves the implantation of electrodes in certain brain areas which deliver electric signals to alter how the brain works to treat conditions such as Parkinson's disease and dystonia. It is also sometimes used in the treatment of epilepsy. I believe that is enough for the biological interventions. Now let's move on to the psychological interventions. Psychological interventions, just like the name suggests, involves the use of psychology to design specialized treatments for individuals with mental disorders. A very popular example of psychological intervention is cognitive behavioral therapy, or CBT. Now, CBT is a structured psychological intervention that helps individuals to identify maladaptive or unhelpful thought and behavioral patterns, to challenge them, and at the end of the day, effectively contributes to treating symptoms of a mental disorder. It is used in combination with medications for a range of problems such as substance misuse, eating disorder, and anxiety disorders. Another example is dialectical behavioral therapy, or DBT. This is typically used for skills training to help individuals manage intense emotions and interpersonal relationships with other people. We also have psychoeducation. And as the name suggests, this is a form of therapy aimed at educating the patient or the service user, their carers, and family to understand the patient's mental health condition, triggers, and coping strategies. Finally, I will talk about stress and relaxation techniques. Now, this is used to help the patient explore what causes them stress, what intensifies their stress, and what alleviates their stress as a means of helping them identify relaxation techniques to deal with their stresses. Examples include box breathing, deep breathing exercises, and progressive muscle relaxation. Finally, we are moving on to the social interventions. Social interventions has to do with those interventions that are offered to individuals with mental disorders in the society or in their communities that are aimed at improving their functions in their communities to prevent unwarranted admissions to psychiatric hospitals and to promote their overall well-being in their own homes. The aim of social interventions points to what we call the deinstitutionalization in the treatment of mental disorders. That means the management of individuals with mental disorders in their communities as opposed to keeping them in mental institutions for treatment. We have the use of community support services. Examples of these are the use of peer support groups such as Alcoholics Anonymous, or AA, and Narcotics Anonymous, or NA. Community support services also include housing support and supported employment, which helps individuals with mental disorders to keep a job and to have their own house. We also have what we call crisis interventions. These are used to prevent the escalation of symptoms of mental disorders, to ensure the safety of individuals affected, and then to prevent unwarranted or unnecessary admissions to psychiatric hospitals. Examples are school-based and employment wellness programs and suicide prevention hotlines. Crisis intervention also ensures the quick and smooth admissions of individuals with mental disorders to improve their care outcomes. This brings us to the end of today's lecture video. If you found this video useful, please subscribe, like the video, and share with others who will benefit from it. If you have any questions or topics you want me to cover, please drop it in the comment section below and I'll do my best to respond to this. As usual, this is Masterminds Nelson. Ladies and gentlemen, class has ended.